insert your air. You're going to turn it toward the syringe to measure. That's much too much.
Oh, sweet.
What is it?
Turn it away from the patient again and suck a little bit of that air out. Oh, I'm getting there.
Are we gonna have to do that for your?
Yes. Oh, there we go.
That's awesome.
Can't wait to practice that.
That is another way of measuring your cuff pressure if you don't have a cuffulator.
I wish I had known that last week. We had a cufflator reception in
They
community
were all
that wasn't
broken.
working correctly.
But we
so
didn't have
we
a
had some
three-way.
trouble.
Where would we
I'm
find
sure
a
they could
three-way
have, you
stop
go to
cuff?
the
Would have
department and
found
ask them for a
one
three-way stop cuff. Ask them if they have any.
I'm
So
sure
when
we
you
could have
insert
found
the
one.
syringe
You
with
could have
air?
done it that way, yeah.
I wish I had known that last week.
Now, the other two ways that your textbooks mention are your MLT and your MOV. Minimal leak technique, minimal occluding volume. You need your stethoscope.
So bring our scopes for our check-off.
Right. Your minimal leak technique is you're going to, while you're listening with your stethoscope, slowly inserting air until you hear absolutely no leak. Back off a little bit until you hear that minimal leak. And then you can still check it with your cuffulator.
So
Now,
that's, ideally you want to hear a little leak.
Ideally, you want that minimal leak, yeah. Because that tells you you're not exerting too much pressure against the tracheal wall. You want a minimal leak, not a big leak.
Do we have any simulator in the lab here that we can actually try something like that, or no? We just kind of just have to tell you we're doing the middle. Okay.
Yeah, because it'd have to be in somebody that was breathing. in order to-
I didn't know
I don't know
that
if I
you
could
had
put him
some
on the
sort of-
ventilator if he could do that. I don't know.
If you have the Sims baby, if we can do that or something.
The what baby?
The Sims baby.
The sim baby? Well, you don't have cuffs on this baby tube.
Oh, so we can't do it.
Right. You don't have cuffs on the baby tube. The minimal occluding volume is almost the exact same thing. And you're going to, with the minimal leak technique, you simply want to check to make sure that you have that minimal leak. With the minimal occluding volume, again, you're going to put it in until you hear just that minimal leak. And then you're going to document the volume, how many milliliters you put in that, 5 milliliters, 6 milliliters. That's your minimal occluding volumes, the volume of air you put in using your syringe.
Wait, so you're insert until you hear minimal leak, and then you document how many milliliters? You do that?
The minimal occluding volume, yeah. How many milliliters of air? That's the volume that you actually put in the cuff. You can't use this one because there are no.
I thought that you do that until you.
I'm going here.
Although
I thought
including,
you did it till
you don't hear
occlude,
any
so
leak.
You don't hear anything. I don't know. I don't remember reading anything about that.
I know you're supposed to do the occluding one first,
Do you
and
want
then
me
you
to
let it
get
out.
And then the minimal leak.
Yeah, but the
They're
occluding
asking you
one.
to do them both?
Yeah, but the occluding one, you're not supposed to hear anything, right?
You want
That's what it said in Egan.
That's what the book
Yeah.
said.
Yeah, I think
I
Egan
have to
said
go
that.
back and read Egan, yeah.
Because that was on Joanne's test.
You will always do it during positive pressure, whether you're using a manual resuscitator or a ventilator. You're always going to listen during a positive pressure breath because that's when the pressure is highest. And even when you're doing your pressure manometer, you always want to get it when you're getting a positive pressure breath. Whether they're on the ventilator or whether you're manually ventilating, you always want to measure it during positive pressure.
Okay. Should we do this together or no?
Do what?
Do we all have to do it or no? Should we do it during practice?
Yeah, which one? I need to see the other part of the book, where it tells you exactly what.